Thank you, Governor. I just wanted to reiterate and take the opportunity to talk again about testing and also about what we're asking every Iowan to do. So we continue to hear questions and concerns, and understandably so, about whether or not people need to be tested for this virus. And I think it's important to keep in mind that not everybody does need to be tested. And in fact, many of us probably will never need to be tested. That's in part because most of us, about 80%, would experience only a very mild kind of illness, similar to a cold or flu type illness. And so for most of us, what we need to do is stay home, drink plenty of fluids, get plenty of rest, stay away from others, cover our cough, and wash our hands. There's not a specific medicine or vaccine for COVID-19 at this time. So for the majority of people who are going to have mild illness, what's more important is that you actually stay home and recover and take care of yourself. That's also going to mean staying home for at least 7 days from the first day that your symptoms start. And we'll want you to stay home for at least 3 days where your symptoms have improved and you've had no fever. Again, because there's not a specific medicine or vaccine, those other measures, those simple measures of taking care of yourself at home, resting, drinking fluids, are really what most of us are going to do for mild illness. Now, there are a subset of the population who are going to be more severely affected, and we've seen that be our older populations and populations with underlying conditions. And so when we think about doing a test in medicine for any reason for anybody, we want to make sure that we're doing a test because we're going to take some kind of action or do something different with that information. That's true regardless of whether we're talking about COVID-19 or anything else. So particularly for our hospitalized patients, we want to test those people because it helps the doctors understand how to care for these patients and what to expect as they care for them. It also helps them know what kind of personal protective equipment, things like gloves and masks and gowns, that need to be used by healthcare workers to protect themselves, but also to protect other patients. And that use of personal protective equipment is also, again, why we wouldn't necessarily want everybody to come and get tested if they don't need it, because we want to make sure that we're making thoughtful use of our healthcare resources. We also want to make sure, again, that as our healthcare providers are using those personal protective equipment resources, it's both to protect themselves and to protect other patients. And thinking about testing individuals who work in the healthcare workforce or in other essential services where they would interact and serve Iowans, that's another group that we're going to want to make sure that we evaluate because it might change some of the actions or things that they would do. I think it's also important to remember that just because you were to get a test if you were mildly ill and it was negative, it wouldn't mean that you couldn't potentially then get exposed later and become ill. And so again, we don't want people to think that a specific test result, if you're not going to take an action, is always going to be required. We're going to want you to work very closely with your healthcare provider to come up with a care plan that's most appropriate for you. And again, for most of us, that's really going to mean if we have mild illness of any kind, we're going to want to stay home, get plenty of fluids, plenty of rest, wash our hands, and recover there. I did